Morning, everyone. I'm Richard van Wylick. I'm Vice Dean of Education at Queen's Health Sciences and Queen's University. Good morning. On behalf of Queen's University and Lakeridge Health, I want to welcome everyone gathered today for this very important announcement. I want to thank Premier Ford, Minister Jones, Minister Bethlenfalvy, and Minister Quinn for their government's ongoing focus and commitment to health sciences education and improving our healthcare system. It's really fitting that this event is taking place here at Lakeridge Health, our incredible partner in education, the site of a regional campus and home to a unique collaborative program dedicated to training the family doctors of tomorrow. Our challenges are clear. We need to increase training for family doctors and improve access to primary care. At Queen's, we believe that hospitals and universities have an obligation to adapt and build our programs in response to societal needs and to help us find tangible solutions to this problem. One of those interventions is reflected in the learners that you see gathered with us. Now in its second year, the Queen's Lakeridge Health MD Family Medicine program has 40 incredible students training specifically for a career in comprehensive family medicine. This first in Canada medical education model is heavily community-based and focused on early, frequent, and diverse clinical placements in the community. It's a seamless program of 6 years that eases the transition between medical school and family medicine residency. Queen's is also the proud partner in the development of a primary care home in Kingston that will serve more than 8,000 people. This collaboration between the Kingston Community Health Centres, the Frontenac, Lennox and Addington, Ontario Health Team, hospitals and the university will offer people in the neighbourhood access to team-based care and serve as a model for other family health teams. It's also going to provide a very rich training ground for our learners, including future physicians, nurse practitioners, occupational therapists, and physiotherapists. And we all know we need them. We also support the training of many physicians that will ultimately serve patients throughout Eastern Ontario through our training programs that are spread across the region, from our family medicine program sites right here in the Bowmanville, Oshawa, Lakeridge area, to the Belleville-Quinte region, to Peterborough, Kawartha, and Kingston and the Thousand Islands, and indeed in small practices and communities throughout Eastern and Southeastern Ontario, and indeed the entire province. Working together, I believe universities, health partners, and government can continue to find innovative ways to improve both training and access to care. And now I'd like to welcome Nolan Quinn, the Minister of Colleges and Universities, to deliver some remarks. Minister.
Thank you, Dr. Wylick. And it's a very small world. I was speaking to Dr. Wylick this morning. He's actually from my riding. The small town of Chesterville is where he was born and raised. Good morning, everyone. As the Minister of Colleges and Universities, I'm so proud of the work we're doing in post-secondary education to build up Ontario's healthcare workforce. An essential part of the work that is giving Ontario students more opportunities to receive high-quality education, to pursue in-demand healthcare careers, and to contribute to Ontario's workforce of dedicated health professionals caring for the people and the families of Ontario. A couple of years ago, our government launched the Ontario Learn and Stay Grant, an innovative program to encourage students to stay local and to train to become the healthcare professionals that local communities need the most. As a resident of St. Andrews West and my riding is Stormont, Dundas, and South Glengarry, which is about as far east as you can go before hitting Quebec, I understand how important it is to have the skilled healthcare professionals in every corner of this province. That is why I'm pleased to report that since the program launched in the last school year, the Ontario Learn and Stay Grant has helped close to 7,500 students begin training in nursing, paramedicine, and medical laboratory technology programs. The grant covers the full cost of their tuition and other direct educational expenses. And once they finish their programs, these students will be the healthcare providers serving Ontario's most growing and underserved communities. We heard from the people of Ontario that we need to train more healthcare workers in Ontario for Ontario. And I'm proud to say we're getting it done at colleges and universities across the province. To speak to you more about how Ontario is strengthening our healthcare system, I'll hand the mic over to my colleague, Sylvia Jones, the Deputy Premier and Minister of Health. Thank you.
Thank you, Minister Quinn, and good morning, everyone. It is indeed a wonderful day and great to be back at Lakeridge Health in Oshawa. Just a few months after announcing our government's exciting expansion of the Lakeridge Health system. I'm pleased, of course, to be here alongside Premier Ford, Minister Bethlenfalvy, Minister Quinn, and our 4 Durham MPPs, including Peter Todd McCarthy, Lauren Coe, and Patrice Barnes. It's also great to see so many of the world-class team here at Lakeridge Health. Thank you for hosting us today and for all you do to provide care to people every day. Each time I visit Durham, it's to celebrate exciting news about how our government is working with our partners to connect you and your family to the care you need in your community for decades to come. And today is no exception. Under the leadership of Premier Ford, our government is making record investments in healthcare, taking bold action, and making innovative changes to provide more people with the right care in the right place. We are expanding hospital capacity with shovels in the ground for over 50 hospital projects, like right here at Lakeridge, where our government is adding 300 new beds through projects in Bowmanville, Oshawa, Whitby, Ajax, and Pickering. We are increasing access to primary care through innovative programs like the first of its kind in Canada, a partnership between Queen's University School of Medicine and Lakeridge Health to create a satellite campus that is training the next generation of family doctors. And by expanding interprofessional primary care teams, like the North Durham Family Health Team, where 6,600 more people will be connected to primary care practitioners. Our government is also improving access to key services, like through the announcement our government made yesterday, tripling the number of new and growing families that can access government-funded fertility services close to home. Today's announcement builds on our government's work to connect every single person in Ontario who wants a primary care provider to get one. We have achieved great progress. With new data from the Canadian Institute for Health Information published yesterday, showing Ontario continues to lead the country with the highest rate of people connected to a primary care provider, and the shortest wait times for joint surgeries like hip and knee replacements. Each action our government takes brings us one step closer to ensuring all Ontarians at every stage of life can connect to the care they need when they need it, closer to home. Thank you again to all our healthcare and community partners who have made today's announcement possible, and for everything you are doing to strengthen our healthcare system and connect patients and families to the high-quality care they need and deserve. It's now my pleasure to turn it over to Minister Bethlenfalvy to share a few words. Thank you. Stay well.
Oh boy, thank you, Minister Jones. It's so exciting to be here. And before I start my remarks, I mean, this is the group who were part of the first cohort. We just met the second cohort. You're standing back there. I mean, some days in government are special, but you know, every day is really special. Maybe this is a little extra special. And Premier, I'm going to take you back a little bit because you're part of the story. When Cindy Davis and Jane Philpott approached Sylvia Jones and me and Jill Dunlop, who was the minister before Minister Quinn, to champion this program, and of course the Premier, like he's the biggest fan of the folks standing behind me and you folks out there, and you saw how he was fighting for you to kind of get some more. You have no bigger champion than the Premier of Ontario, but you've got a great team of people like Sylvia Jones, the Minister of Colleges and Universities, working with everybody to make this program, with the folks standing behind me and some of you out there, a reality. And I mean, just how good does that make you feel, and our colleagues here today. So a big shout out to the first cohort and the second cohort. Thank you for being here. I also have to give a shout out to our regional chair, John Henry, who's standing to my right, and the great mayor of Oshawa. If this guy doesn't fight for his community every single day, you're doing a fantastic job, both of you. Thank you for supporting communities here in Oshawa and Durham. You know, folks, building healthier communities is a cornerstone of our government's plan to build a better Ontario. And we have been working tirelessly to improve access to primary care for people, families, and their loved ones in underserved and growing communities across the province when and where they need it. We know that access to a family doctor is key to a healthy life, and that is why we have made investments to address staffing shortages and improve access to primary care, as the Minister of Health just outlined. Whether it's healthcare professionals or the skilled trades and construction sector, we are working to build our workforce, and it's our plan to rebuild Ontario's economy and keep costs down for people and families, and that plan is working. But folks, there's more work to be done. In a few days, I'll have the privilege of releasing our 2024 Ontario Economic Outlook and Fiscal Review. The fall economic statement will advance our government's prudent, responsible, and targeted approach to managing the province's finances. L'exposé économique d'automne mettra en relief l'approche prudente, responsable et ciblée que notre gouvernement adopte dans la gestion des finances de la province. Together, we're working to build a better Ontario today for future generations. Now it's my great honor and privilege to pass the podium over to the Premier of Ontario, Doug Ford.
Well, thank you so much, Peter, and good morning, everyone. I was wondering if I could have a little request here. Could we get the second cohort to come and slide around here and just kind of stand there if we could? That'd be greatly appreciated. Just stay tuned for 30 seconds, folks. They're great people, fantastic. Well, I didn't realize there were so many of them. I thought there was 4 or 5. Well, the more the merrier. Oh my goodness. That was good. See, these are the future docs that are going to be taking care of us, and thank you, everyone. You guys are amazing. Wow. Well, it's great to be back here in the beautiful city of Oshawa, and you've heard alongside my great Deputy Premier, Minister of Health, Minister Jones, and Minister Bethlenfalvy. He's pretty modest, but he's the one that funds all of this, and Minister Quinn and Minister McCarthy, MPPs Lauren Coe and Patrice Barnes, the part of the Durham 4, as we call her, Durham 5. Before I get started, I want to acknowledge Mayor Carter and Regional Chair Henry. Both are incredible for the region. Chair Henry, you've done an incredible job for the region. But Mayor Carter, he's special. He's unique to any other mayor. You know, he understands mental health and addiction, unlike anyone, any other mayor in this province. Not knocking the other mayors, but he does an incredible job, and thank you for doing a job every day, Mayor Carter. And thank you for joining us. And a big thank you to Cynthia and everyone at Lake Ridge Health, and I can't help but call out my good pal Cornelius, the chair of the board. I called her out last time. This is like old time. Look, she's hiding now. But anyways, you do a great job, and Richard and your team from Queens. And Dr. Dominique Novak from the Ontario Medical Association. We couldn't do anything in our healthcare system without great leaders like Dominic and the rest of the team at OMA. And we're just so thankful for your program here, a first of its kind program in Canada to train family doctors. We're always blazing a new trail here in Ontario, and I'm so proud of the team that we have. We're excited to see the impact this will have. Since day one, in addition to the investments we're making to build and expand hospitals, our government has been focused on bolstering our healthcare workforce, recognizing the critical role doctors and nurses play in our health system. We've been working closely with our universities and colleges, our hospitals and associations, and since 2018, we've added more than 12,500 doctors and more than 80,000 nurses in Ontario, with another 30,000 nursing students in school. At the same time, we've embarked on the largest expansion of our medical school system in decades to make sure we have the doctors we need for the future. Last year, we announced an additional 260 undergraduate seats and 449 postgraduate positions at medical schools across the province, and at the future home of the new TMU Medical School. And in March, we announced the design and planning of a new medical school at York University, which will focus on primary medicine. Because of our plan, because of these solutions, Ontario now has shorter wait times. And we currently lead the country with nearly 90%. I think Kai came out and said it was 88% people connected to regular healthcare providers. But we all agree 90% does not cut it. That's unacceptable in my opinion, and I know our minister's opinion. We have to connect 100% of the people, and we can't stop there, and we won't. This week, Minister Jones announced the appointment of Dr. Jane Philpott, Dean at Queen's Health Sciences, as the chair of a new primary care action team. And I just got to be clear, Dr. Philpott, what a champion she is. She's not going to be writing sheets and everything and handing them in. She's going to get the action done. She's going to be on the ground fixing that gap of the 12%. This new team is going to work closely with our government to ensure that within the next 5 years, every single person in Ontario is connected to primary health care. And today, I'm thrilled to announce that our government is investing $88 million over 3 years to help more Ontario students become family doctors. This funding, as part of our expanded Learn and Stay program, will cover the tuition and direct educational cost for students who commit to practice family medicine in Ontario once they graduate. That is a game changer. I'm gonna stop just for a second here, and then I'm gonna continue on. But do you know what made my day? Like, it just made my day. So I'm leaving, the prep room back there, and I'm walking down, and a great medical student, just so happens to be from the great state of Etobicoke, came up to me so sincere and said, "This is life-changing announcement." And I don't know if she's here. Where are you? There, you're hiding. Come on over here for a minute. Don't be shy. But, when a medical student says that this is a life-changing announcement, it's incredible. I caught you on the spot, but do you want to say 15 seconds or 10 seconds what you think?
Definitely on the spot. Yeah, it is life-changing for someone that's applied to medicine for several years. It can be such a great expense, and it's such a great opportunity to practice family medicine, and knowing that family medicine is what I want to go into and what everyone behind me wants to go into. It's great that we can get this early clinical practice and these early skills.
Thank you. I told her she has a great handshake too, but I feel like they're lawyers now because I'm trying to backdate this for a year or two because I'm sure some of you have debt from medical school. Did you hear that, Mr. Moneybags? Don't worry, I will represent you guys well. I promise you, but it's only fair, right? But today, we're also announcing that our government will prioritize med school seats for Ontario students. Starting in the fall of 2026, all Ontario medical schools will be required to allocate at least 95% of all undergraduate seats to residents of Ontario, with the other 5% reserved for students from the rest of Canada. And you know something? This has been gnawing at me for years, as my colleagues know. I found out because you'd go out to events and I'd say, how are the kids? Well, they're studying in Ireland, or they're studying in the Caribbean, they're studying in the U.S. And what happens? They meet someone and they don't come back home. So I've just been all over our Minister of Colleges and Universities, and there was 18% students from around the world taking our kids' seats and then not even staying here and going back to their country, and it's just not right. So now it's going to be 100% Canadian, 95% Ontario, so I'm glad we're getting this done. Medical schools will also have to create more opportunities for Ontario students who started their medical education abroad to be able to complete their postgraduate training here in Ontario. These new actions are designed to ensure Ontario medical schools are training and graduating more doctors, including family doctors that are going to stay in Ontario. Because we know that if you're born in Ontario, you're more than likely to stay and practice in Ontario. Friends, we're going to keep working with our colleges, universities, and our hospitals and associations to ensure everyone has the access, the care they need when they need it. Whether it's building new hospitals, adding new medical seats, or investing in our healthcare workforce, we're going to keep working together to build up our healthcare system. Thank you, and to everyone at Queens and Lakeridge, thank you for your participation, your leadership and dedication, and may God bless the people of Ontario. Thank you.
We will now open the floor for questions from the media. Please come to the mic and stand right behind me. Just a reminder, it's one question, one follow-up. First question.
So all the medical students get ready. When they ask me about bike lanes, I'm going to hand it over to you guys. Okay? Okay, here we go.
Hi, Premier. Jack Howard from the Trillium.
Hey, Jack, how are you?
Good, thanks. On bike lanes, just kidding.
Okay.
I did want to ask, I understand this might be a hypothetical question, but if a government were to give all its voters free money and then call an early election, would you call that a bribe?
No, not at all. It's just moving the government forward. You know, that's the last thing on my mind, to be very frank. This job entails, with all our ministers and our partners here, to keep moving nonstop. Folks, it's 18 hours a day. Make no mistake about it. You just go, 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 go. A million things are coming at you. And I just believe in one thing: surrounding myself with the best and the brightest minds there is in their sector. And that's been my philosophy in business. It's my philosophy in politics. And we're just going to keep moving the province forward in the right direction. I'm blessed to have the best people anywhere in the world living here in Ontario and supporting the program. We're working all together. It's amazing, actually.
On a different topic, given the numerous recent scandals and investigations into school boards, is it time to, wouldn't it just be easier to get rid of the school board model altogether?
Well, they frustrate me. Folks, do you believe that the school in Brant County school board trustees, they go out there and they decide to go on a fancy trip to Italy? They spend $45,000 of taxpayers' money, but guess why they're going to Italy? And I love Italy, by the way, but guess why they're going? To buy $100,000 worth of artwork in Italy for their school. Like the cheese slipped off the cracker with these guys. Like, I just don't get it. Common sense, you know, or the other group that decided it'd be a great idea. When all the medical students love to go down, watch the Blue Jays game, stay in the Blue Jays hotel, and blow $16,000 of the taxpayers' money watching a baseball game. Unacceptable. And the stories go on and on and on. That's why I've directed our Minister of Education to start doing audits on these school boards. They're first to scream. They need more money, and so on and so forth. We're pouring money into school boards. And they're out partying and, acting like a bunch of yahoos. Unacceptable. You're elected. You have to respect the taxpayers' money. Or one more. I'm on a roll here, because another one. I get a call from someone up in Simcoe. Simcoe region, councillors, I guess they're called. I don't even know why we even have the region. But here nor there, they vote themselves, ready for this one, 167% increase in salary. Wouldn't that be great if we could all just increase their salary? And it's like the fox taking care of the hen house. They're all voting for their increase. You know, they were it was a part-time job at 18 grand. Now it's 57 grand. Like, this has to stop. That's what frustrates me, when you're wasting taxpayers' money and then you're out on the other side screaming, I need more money. Well, stop blowing the taxpayers' money and be responsible. It goes back to, we've never raised a tax. The only government in the history of this country, we've never raised a tax on people or businesses. We never will raise taxes.
Clara Pasica, CBC. So, Premier, on the home care issues with critical supplies not arriving, we've heard that it's a distribution issue, not a supply issue. Now, that sounds like exactly the type of thing you prided yourself on as a business person, yep, doing well at. So why has your government failed on this issue?
Well, it's that program. I'm going to hand it over to the Minister of Health here, but they had to pull me off the ceiling. When I actually get calls on my phone saying I need gauze, I need Band-Aids. But people are going to be held accountable as sure as I'm talking to you.
Yeah, the Premier's absolutely right. It is unacceptable, and it is a distribution issue where certain patients have not been able to get their critical medical supplies and equipment on time. We've actually brought in a team and are working directly with the vendor who's having these issues to make sure that the supplies that they have in-house are getting to patients. The other piece that we've done is we directed Ontario Health at Home to make sure that any patients, families, caregivers who went out and bought those critical supplies now have a pathway for reimbursement, and those checks have started to be issued. Completely unacceptable. In the weeks ahead, we will absolutely be asking some very tough questions about why they had such a challenge. But right now, the focus is and must be on the patients. Thank you.
And back to the Premier. Premier, you've been meeting with mayors as well as your minister with the mayors of Peel region related to that messy breakup sort of situation. How are those negotiations going? Are you making utility? Are you downloading roads to the cities? What can people expect in Peel? Yeah,
we're meeting with all three mayors. They're great mayors, by the way. They all get along. I guess the previous mayor of Mississauga wasn't getting along with the mayor of Brampton, but that's all straightened out with the new mayor. So they're getting along, and we're going to work through this and make sure that that region's taken care of and each individual city is going to be taken care of. So far, so good. We're just ironing out a few wrinkles. But the most important thing, everyone's sitting around the table, and we'll get it resolved. So that's good.
Premier Mark McAllister from City News.
Hi.
You've got one plan here today. You've announced other things in and around new hospitals. I'm just curious at this point, why bring on Dr. Jane Philpott? What does she need to do based on the fact that you've got some answers here anyway?
Well, first of all, I have the utmost respect for Dr. Jane Philpott, and so does everyone else in the country. A huge asset. I always believe in building our team with the best of the best, and her job is going to make sure that we connect that gap of whatever 12%. And you know, Kai came out and said, yeah, we have the best in the country. That's unacceptable, in my opinion. We're still 12%, and 12% of 16 million people, that's a lot of people. You're up to close to 2 million people. But through the leadership of our great Minister of Health and Deputy Premier, they're going to get it done. Did you want to say a few words about that? I'm so blessed to have her. I'm telling you. She's the best.
Yeah, you raise a good point. So we are taking a government-wide approach on this. You know, when we expand medical school seats, we're working with other ministries to make sure that can happen. When we work with the OMA to make sure that we have coverage. But Dr. Philpott's role will be very specific, and that is closing that gap. We've done excellent work expanding 78 new primary expansion teams that were announced in February. We already have some of those teams hired up and taking on new patients in places like Peterborough, but we want to do more. And having Dr. Philpott lead those efforts, having those conversations with existing and operating primary care practitioners allows us that opportunity to go faster. And as Premier Ford has mentioned, you know, in the next 5 years, we intend to close that gap. Everyone in the province of Ontario who wants a family physician, a family primary care practitioner, will have the opportunity within the next 5 years.
Minister, you might want to stay at the podium. I would assume that the Premier is going to allow you to answer this as well. Yesterday, your colleagues from across the aisle introduced a bill specifically to stop private clinics where nurse practitioners have started to charge patients user fees for access to health care. How do you stop that from happening?
Well, you know, I've been working very directly with the federal government. When the Canada Health Act came into force, there was not a vision where we had nurse practitioners in the province of Ontario. And again, I will look to Ontario's leadership. Ontario was one of the first Canadian jurisdictions that actually allowed nurse practitioners to be part of primary care teams, to have their own group of patients that they serve. So I have called on for many months the the federal government to close the gap in the Canada Health Act. Unfortunately, as is often the case, what the opposition is suggesting is, frankly, a Band-Aid stopgap solution. We need to make sure that primary care practitioners, including nurse practitioners, have the opportunity to practice in a multidisciplinary team. And in some cases, in the province of Ontario, we have over 26 that operate their standalone primary care teams. We're going to keep doing that work. What I need the federal government to do is clean up the Canada Health Act to make sure that something that is happening Canada-wide is dealt with at the federal level. Thank you.
Siobhan Morris, CTV News. I'm going to call on Minister Jones, actually.
Yeah, sure.
I'm wondering if you can help expand on this idea of why it's important to prioritize Ontario medical students, and if you have any worry about any accusations of protectionism closing Ontario off to a potential talent pool from outside the country.
So I'm sure that Minister Quinn will talk about the percentage of Ontario taxes that go into training our medical clinicians, whether they are physicians, nurses, lab techs. We're making an investment in Ontario residents, and then when there are other opportunities, Canadian residents. We know through our data that when students train, practice, and learn in the province of Ontario, they stay. Northern Ontario School of Medicine, we see through their data that when you train in Northern Ontario, you have a much higher chance and percentage who continue to practice in the North. So we want to bring that talent back to Ontario, and we're doing that by an investment today that says Ontario students need to come first. We still have a small pathway for Canadian students because we also understand our responsibility as the leading province, Premier's role as the head of COF. But we're going to prioritize Ontario residents because those are our taxpayers that are paying those students to go to school. Thank you.
For the Premier, CTV News has been reporting this week on these very high costs that visitors to hospitals, staff at hospitals have been paying. Do you think it's fair that people who are visiting a sick loved one have to pay out of pocket, upwards of $2,000 a year just to be able to see someone they love?
Yeah, I don't think it's fair, but I know the CEOs would be very upset with me because that's a stream of income that they use to run the hospitals, to buy equipment, and do other things. I'm going to have to leave that one up to the hospital. Do I think it's fair that a nurse coming and they have to pay for parking? I don't think it's fair, but I'm going to leave that up to the hospitals. Each hospital can run their hospital the way they want when it comes to parking and a few other things. But that's a challenge, right? And I'm sure if you ask the hospital CEOs, they don't think it's fair, but they have to get some income in as well. That's a tough one. I side with the nurses and the docs. Sorry for the CEOs, but I'm siding with the nurses and docs on this one.
Premier Tim Kelly from Metroland. I was just going to throw this out there as maybe a possibility, but has the government considered the option of dropping the tolls on the 407 as opposed to building this tunnel under the 401 as being maybe a lower cost alternative?
Great, fantastic question. So we own the far end, I think from Harmony Road 35, and I've requested our Minister of Transportation look into that. Let's drop the tolls, what we own. On the other part of the 407, we'll sit down and speak to the owners, but I've said this, the worst thing a government did was sell the 407 for $2.5 billion or thereabouts, and now it's worth $35 billion. And that's going to be at capacity at another 20 years, 25 years. 401's already at capacity. All 400 series highways will be at capacity. So I don't think it's either or. I think it's and. We got to look at the 407, but we also have to look at the tunnel because it wouldn't make sense just to do the 407 and it's jammed in 20 years. But we'll study it. We'll do that feasibility study and get moving. Great question. Thank you.
Okay, just as a follow-up, would you be able to, if you look at that as a feasibility study, would it be possible to fairly quickly do that toll drop? I mean,
I believe so.
yeah, because building that tunnel could take perhaps decades.
So, yes, and it probably would, and therefore, by that time, hopefully the tunnel will be ready and the 407 could relieve it. But it's almost like, and I've heard this question about leasing. That's what we're doing, basically leasing the 407 back. I don't like leasing. I like ownership of any asset that the province has. But great ideas, and folks, I want to thank you for all your ideas, including the people in the media, because that's where we get the best ideas. I have engineers. I got everyone coming up with ideas, and I think that's great. Actually, really good. A lot of bright people out there, by the way.
Premier Ford, Craig Smith with Durham Radio News. You say the goal of the expansion of this program is to increase family doctors in Ontario. Is there any provisions in giving these grants to keep them in Ontario? And what if they decide to switch to a different specialty instead of setting up a family practice?
So with our existing Learn and Stay program, and I'm sure Minister Quinn can elaborate further, but with our existing Learn and Stay program, if an individual decides that they do not want to practice in an underserved or quickly growing community, then there is an opportunity to transition those grants into the more traditional OSAP loan program.
All right, and today's announcement is kind of about the future, but a report from the Ontario Council for Hospitals says that there will be a shortfall of staff by tens of thousands in the next few years. So what is the province doing to keep current workers from burnout and leaving the job now? It's a great question, and something that we've been working very closely with our hospital partners. We have some really creative, innovative ideas that are happening in our hospitals today, whether it is utilizing more of the AI piece to do flow-through for emergency departments. The Ontario Medical Association, of course, is partnering with us with a pilot allowing AI Scribe, which is essentially the ability for that physician to be focused on the patient and having the notes and the follow-up tracked and ultimately reviewed and approved by physicians. That pilot is still in progress, but what we are hearing, certainly anecdotally to date, is that it has very much allowed physicians to have more time in front of their patients and less time in paperwork. So all of these pieces together are what we're working at as a government to ensure that any technology, any new innovation, we now have an innovation fund pathway to allow practitioners, physicians, hospitals to come forward and say, we have an idea, we'd like to pilot and try it out in our hospital or our area, and we have a pathway now for them to do that. So some exciting pieces happening on the innovation side.
This will be the last reporter.
If I could just add on to what the minister was saying, I'm just a massive fan, and as with Minister Jones, on robotics. That's the way of the future. We were out in Hamilton at St. Joseph's, and it's just mind-boggling how far they've come, and I really want to do everything we can to fund robotics, and especially our new docs that are coming into the system. They want the latest and greatest tools that are out there, and I'm going to do everything I can to make sure you have the latest and greatest tools. If you've ever seen those robotics in action, it's really, really impressive. Less time in the hospital, less invasive, more accurate. So at the end of the day, it's a money saver. So we're going to do everything we can to invest in robotics in the future.
Doug Boyd from Rogers TV. Premier, what's the normal wait time it should be for see a doctor in a hospital? We're seeing some people waiting up to 6-7 hours to see a doctor. What's a reasonable wait time for you and for this government to see a doctor in a hospital?
Well, I'd like to move as quickly as possible. If it means if someone came to me and said, we can get every single emergency department, less than an hour, and this is what it'll cost, I'll do it. I just want to, folks, let me describe this to you. I spent 20 years of my life in Chicago and New Jersey, all throughout the U.S. And yes, a few times I've had to take workers or myself to the hospital. your butt doesn't hit that seat for longer than 2 minutes and you're moving. And we got to focus on lean methodologies. We have to make sure they have the finances. But the public has a responsibility too. And what I mean by that, when little Johnny cuts his knee and he's in the emergency department, it's up to us to build a system that he can go down to the clinic that does stitches or broken arms or broken legs. Every emergency doc I talk to, they're guesstimating 50% of the people shouldn't be in the emergency department. They should be down the hallway, and the real emergencies should be there. I'm going to give you one example. As you know, I get hundreds of calls on my cell phone. I get a call, this lady, you know, I won't say where it was, but anyways, you know, I had to go from hospital, my main hospital, to the other hospital. And I waited 4 hours before I got, you know, someone to see me. And I said, ma'am, you know, would I be able to ask you why you went there? She goes, I had a really sore throat. And I was like dumbfounded. So you're taking a spot in the emergency department for a sore throat. So, you know, we have to be responsible. Go to your family doc first, and he'll determine if you're going to the emergency department. Emergency department is for emergencies, not little Johnny cutting his leg or so on and so forth. You got a headache or a sore throat. Doesn't cut it. I'm sorry, go ahead.
It's exactly why we are focusing on primary care expansion. It's exactly why we are focusing on multidisciplinary teams, because we want people to have an option that is not only and exclusively calling 911 or visiting the emergency department. You know, we have the ability by training more primary care physicians. We have the ability by funding more multidisciplinary teams to ensure that people don't have to go to an emergency department. And I will say, when you go into an emergency department with a severe medical crisis, you are being seen. You are being seen very quickly. It is, to the Premier's point, the individuals who don't have that critical emerging emergency that are having to wait because they are dealing with sicker patients first, appropriately. Thanks.
It might be for you as well, Minister. We're seeing a high number of flu cases going up across this province, plus with COVID. Is the government going to have to mandate the masking back in hospitals again, or are you guys going to leave that up to each individual hospital?
So the Government of Ontario has never actually mandated masking in hospitals. We left that very specifically to hospital leadership, because we know that depending on the hospital and the community that they serve, they will make those local determinations, and we will continue to allow them to do that. What we have, which we didn't have 3 or 4 years ago, is we have some pathways now to ensure that not only, as we always have, offered COVID vaccines, offered flu vaccines to our at-risk elderly, our young people, but we also have a pathway through our pediatrician and under 5 through RSV to make sure that people have the option of getting covered. And I think those are the changes that we are making, including, frankly, a $330 million investment in pediatric care specifically to make sure that our 4 pediatric centers and other hospitals have the ability to ramp up and expand their services to make sure that any increase, any surge, we will have their backs, and we're preparing for that. Thanks.
Excellent. Well, thank you, everyone. Thank the medical students. Thank the whole team here. God bless you, and we're going to get it done. Thank you so much.